The murmur of aortic regurgitation is a high-pitched diastolic murmur that begins immediately after the second heart sound, as shown in the phonocardiogram. This murmur is usually heard in the third or fourth left intercostal space with the patient leaning forward. The length of this murmur is directly related to the regurgitant volume in most patients. Typically, a pulse pressure greater than 100 millimeters of mercury accompanies severe aortic regurgitation. The murmur of aortic regurgitation is heard best with the diaphragm pressed firmly against the chest wall. This murmur can be increased by having the patient tighten both fists. Listen to the change in the murmur of aortic regurgitation with a hand grip maneuver. Rest. Hand grip. If this murmur is heard at the lower right of the sternum, then aortic root pathology such as an aortic aneurysm should be suspected. Echo Doppler studies can show the severity of aortic regurgitation. Notice how this color jet coincides with the onset of the murmur. This figure shows the direction of regurgitant flow in this disease. In summary, the murmur of aortic regurgitation is a diastolic, decrescendo murmur which is high-pitched in character and heard best in the third or fourth left intercostal space.